Okay, hello everyone. Welcome to this instalment of the college webinars. This particular webinar is focused on updating you about the effects of COVID-19 on pre-vocational surgical education and training, and also about the early exams in the pre-vocational period. My name's Adrian Anthony. I'm a general surgeon in Adelaide. I also chair the Board of Surgical Education and Training, and that's the board where all the specialty training boards are represented. I would like, on behalf of the college, to acknowledge the traditional owners of the country throughout Australia and recognise their continuing connection to land, waters and community. And I would like to pay my respects to them and their cultures and to their elders past, present and emerging. Tēnā koutou, tēnā koutou, tēnā koutou katoa. So now tonight I have a stellar panel. Jennifer Chambers, wave your hand, Jenny. So Jenny is chair of the Jenny's the chair of the Pre-Vocational Skills Education Committee. So that's the committee that oversees the skills courses that many pre-vocational doctors would be accessing. And Jenny's a member of College Council, and she's a vascular surgeon based in Port Macquarie in New South Wales. Richard Wong, wave your hand. So Richard is the chair of the exams committee, something that you're all very interested about tonight. And that's the exams committee, particularly as it relates to the general surgical sciences exam and the clinical exam. And that exams committee also runs a number of the specialty specific exams. Richard is a plastic and reconstructive surgeon in Auckland, New Zealand. Linda Tang, welcome Linda. Linda is a member of our College Trainees Association, and she's a second-year set trainee in general surgery based in Sydney, New South Wales. And I guess, Linda, you're probably the closest amongst all of us here on the panel to the ground, and you'd be better able to identify what the junior doctors have been having to experience over the last couple of months and the disruption to their training and work. We also have Professor Kerin Fielding. Evening, Kerin. Kerin is Deputy Chair of the Board of Surgical Education and Training, and she also chairs the IMG Committee. Kerin is a member of Council, and she's an orthopaedic surgeon based in Wagga in New South Wales. And I should add that Kerin also has significant involvement with New South Wales Health Education and Training Institute, and from that point of view has had significant interaction with pre-vocational junior doctors, particularly those who are surgical aspirants. So welcome, Kerin. And Julian, Professor Julian Archer, welcome, Julian. Julian works for the college. He's the Executive General Manager of Education at the college. He's based in Melbourne. He holds professorships in medical education, and he is a paediatrician by training. So welcome, Julian. And in the background, we do have a couple of our college staff, Grace Chan and Shannon, running the show. So thank you, panel. And I have to say, I think this particular webinar has had significant interest. I think we had over 400 registrants, and we had almost 100 questions submitted pre-webinar. I will remind attendees that you can send questions through the webinar, and these will be addressed by the panel throughout the session. You will all notice that you have a questions pane on your control, and so if you were able to type in your question, then send those through. We will try our utmost best to answer your questions tonight. If we can't give you definitive answers, we will chase these up, and over time, when we do get those answers, we will post them up on the college website, COVID Hub. And I'm sure as time goes on, we are likely to hold another webinar specifically for pre-vocational junior doctors. So keep an eye out for that. Out of the questions that were submitted, quite a lot of them, as I said, we were able to condense those questions down to about 4 key themes. The first theme is around the conduct of the clinical exam and the general surgical sciences exam, or the, generic surgical sciences exam, the GSSE. Another theme was about set selection during this year, 2020. Another theme was about set selection in 2021 and beyond. And the final theme is about college face-to-face courses. So within those themes, we will address all the questions that have been asked. So Richard, I thought I'd open up with you and ask you one of the most common questions that came through, and that is, when will I be able to sit the clinical exam?
Right. So the clinical exam isn't running in 2020, and there are multiple reasons for that. The plan is to have them running again in 2021. And in 2021, we're hoping to run them in the normal time spaces, which is February, June, and September/October. The number of candidates that we can actually host we've actually always had more capacity than there actually have been applicants. So the interesting thing is that we can handle up to 160 and possibly even more candidates in any one of those 3 settings. And for those people out there who aren't set trainees, you can apply to any one of those 3 settings. For those of you who are actually set trainees, you're restricted to the first 2 only, and you're prioritized. But at the moment, due to all the uncertainty that is around, and also the need to keep people safe, and also, dare I say it, the need to be able to prioritize the things that we're trying to do to make sure everything runs, the clinical exam is not going to be run this year, but will be run in 2021, barring a major disaster, 3 times that year, with capacity that has yet to be tested. So in other words, we can actually, if you're interested, register, and we will do our very best to accommodate.
Yeah. So Richard, you sound confident that in terms of capacity, particularly at the start of the year, you will be able to meet perhaps maybe even a larger number of applicants than would normally apply?
Yeah, so I think people forget that the clinical exam many years ago used to be mandated for all the surgical specialties. And so we actually had to be able to run to up to 200 candidates in one sitting. And, we have actually been, been able to run that, but there hasn't been the demand as large specialties have pulled out. And so there is actually space for pre-vocational candidates to actually apply. To be fair, there is a ceiling limit that we can host safely. And for those first 2 exams in the year, we will be prioritizing set trainees. But just so that people know, there are only 90 set 1 and 2s in the specialties that still mandate the clinical exam. Translation is there's a lot of spare capacity for pre-vocational candidates if they wish.
Okay. All right. So it sounds like no clinical exam this year, 3 next year. And there should be sufficient capacity to meet increased demand, although there will be a limit, of course. Okay. Yeah. While I've asked you that question, are you able to comment about the GSSE exam? Will that be run this year?
Okay. Well, I'm very pleased to announce it is completely hot off the press, as in about 30 minutes ago. So I'm sure candidates now will be poised. I wish I could do a drum roll. November 4 and 5, Wednesday and Thursday, is when we are planning to run the GSSE. We've got the venues secured. There is one caveat, and the caveat is for those candidates in Brisbane at the moment, we're struggling to find a venue that meets our very, very strict requirements. And so, for those of you who have struggled with internet connections will appreciate that any exam run over the internet, we need to make sure that the venue is up to speed. And our usual vendor in Brisbane at the moment isn't available, but they're trying to source another location for us. So in all the other places that we normally run, so that's Perth, Melbourne, Adelaide, Sydney, Auckland, and Wellington. They're all good to go. We're working very hard for Brisbane. I note that one of the questions was about the Northern Territories. I will be honest, I'm afraid I didn't realise we weren't able to run in the Northern Territories. We do have time. We're going to do our utmost, like we are doing with Brisbane, to see if we can find an alternative arrangement. But there are very specific requirements for internet reliability and connections to make sure that candidates aren't disadvantaged. When you're actually running an internet-based exam, you haven't got secure and reliable connections, then that actually puts the candidate at risk. So we're going to investigate for Brisbane and also for Northern Territories venues that meet our standard.
Yeah, so there will be endeavours undertaken to identify suitable locations in those two areas, particularly in Northern Territory, where it can be difficult otherwise to access these the GSSE. And similar question about capacity. Given that you're running it once this year, will there be increased capacity to accommodate for any demand?
So one of the advantages of the GSSE is social distancing is already built into it, because you can't sit too close to one another's monitors. But we've checked with our providers, electronic providers, to be able to do the quarantine. Long story short is we normally gear up 300 people across both Australia and New Zealand. We're predicting maybe up to 450, although we'll know for sure once everyone's finished registering, and we will move heaven and earth to make it all possible. The exam can be ramped up. It's really just making sure we have suitable venues with suitable social distancing so everyone can be there and not be compromised.
Right, thank you. Okay, and I may have missed it, but number of sittings next year for the GSSE?
Is 3. So the normal every year.
So, okay. Yeah. Okay. Thanks for that, Richard. Kerin, a question for you, and it relates to the GSSE and the clinical exam. They're both prerequisites for many of the training programs. Given that the clinical exam is not being run this year, how are training boards going to indicate, or are they going to indicate that it still remains a prerequisite for selection in 2021 for 2022 allocations?
So as Richard said, if those exams can run next year, then those candidates will be able to sit in 2021. But the college has said that no candidate will be disadvantaged if the exams can't be run. So you certainly will be given plenty of warning if you have to do it in time for next year. And I'm sure if the exam can't be run, we're sure that you will be given extra time to do it either next year or into your first set year.
Yeah. So my understanding from the training boards is that if we can't run the clinical exam this year and the training boards still want to conduct selection next year, then it's highly unlikely that they will require the clinical exam to be an eligibility requirement. If they still need it to be completed, they may have to accommodate that during training.
Yes,
right.
During that set, preferably during the set 1 year. Yeah.
Yeah. And the GSSE, my assumption is that if it's been run this year, then it's reasonable to expect that it's still a requirement to be eligible to apply for set next year.
Correct.
Yeah. Okay. All right. Well, thank you very much. Does anyone else want to make any other comments about the exams, particularly the clinical exam and GSSE? No? Excellent. Okay. So we'll move on to another theme, again, very, very topical, and this is about set selection. So many, if not all of our attendees tonight will be aware that the college suspended set selection this year early on in the piece, but only recently, just over a week ago, announced that it is working with many of the training boards, or all the training boards, to see whether it can conduct selection later this year. And my understanding is that cardiothoracics is the one training board which is still looking at whether it is feasible and appropriate for them to run set selection. But all the other training boards have indicated that they are probably going to run selection. So Julian Archer, are you able to tell us some timelines and also who will be eligible to apply for selection if it's run this year?
Absolutely, Adrian. So as you say, set selection has reopened and it closes on Friday, the 12th of June. That's at 12 noon, Sydney, Melbourne time. So that's Friday, the 12th of June. And the process will follow a similar route, but obviously slightly delayed to the normal timescales. The referee reports will be collected in July, August. And then there's quite a big window for interviews to accommodate the different specialties, and that'll run between the 24th of August and the 25th of October this year. And those who are eligible to go through selection this year are those who previously registered for selection back in January. So it's been reopened for those who registered at the beginning of the year.
Mm-hmm. Okay, thank you. And so just to be clear that all the training boards except for cardiothoracics have said that they are planning to run selection and they are preparing for that, looking at ways of ensuring that that occurs. And cardiothoracics has said that they are still looking at the feasibility and they have not made a final decision on that. So as soon as that decision is made, we will inform the potential applicants for that program. Okay, and Kerin Fielding, I'm going to throw back to you again. So in terms of running selection this year, and I guess the important part of the selection which may not be, will be disrupted, I guess potentially disrupted, is around the interviews and any normal face-to-face interaction that would occur. How will selection processes accommodate for travel restrictions, quarantine requirements, and of course social distancing requirements?
So if the travel restrictions are lifted, then the interviews will probably be run face-to-face as they normally are. But at the moment, new interview methods are being explored by the college in collaboration with all the specialty groups, and it's anticipated that they will be done online.
Mm-hmm. Right, okay then. So, and what about for if an applicant is successful at being offered an interview, how much time will they have? Because that's the shortlisting process. So how much time will they have to then prepare to go to the interview? And if they have to travel, given that travel restrictions may still apply without with quarantining requirements, how much time will they be given?
Yeah, well, that's still a little bit up in the air. A minimum of 5 days is what the specialty boards have been saying. Obviously, if we can give them more time, we will. And again, that just depends on the travel and so on, whether the restrictions are lifted.
Yeah.
Yeah, so that's still a little bit up in the air, but we're working on it.
Yeah, I mean, I think 5 days sounds very short, and I know that the 5 days is a minimum, but I think most training boards are looking at a couple of weeks, if not even longer, to allow people to have enough time to travel. And the 5 days is more likely to occur for those specialties who are able to run selection online in a regional or online manner. Yeah.
Correct.
Okay.
That's right.
Okay. And for those who will do it face to face, let's say it's possible to do it face to face, will they be conducted in a COVID safe manner?
Absolutely. Yes. Absolutely, with social distancing and numbers and so on. So that's all being organised at the moment, and that's obviously quite difficult. For example, in orthopaedics, we often have 35 to 40 people in one room, so that all needs to be changed, and all those processes are being looked at the moment. But it will be definitely in a COVID-safe manner.
Yeah, and And of course, the larger specialties will be able to run, much more likely to run selection in their own region or even in their own country. But what about some of the smaller specialties? I mean, vascular and pediatrics typically run it as a one centre. So if you are, but if you're in say New Zealand or in Australia, will you be expected to travel across the Tasman to attend selection?
Well, again, it's going to depend on the travel restrictions and what's possible. So we'll certainly do our very best to fit it. Well, absolutely fit in with all the restrictions and try and run selection in different sites as available.
Yeah. Okay. Thank you, Jenny Chambers. I have a question for you. Will the selection criteria, that is what a candidate is selected on and the questions they may be asked, will they change or will they be the same as in the past, given that we're now in a COVID environment and we're going to change some processes?
For 2020 selection to 2021, the requirements are the same as they were before we closed the applications in March. So those regulations and requirements are not changing. So if you weren't able to fulfill those requirements by end of March, then nothing new now applying now in the last few months is going to count. So these regulations aren't changing.
Right. Okay then. And what about for 2021 selection into 2022?
Well, I think that's
will those selection criteria change?
They will be certainly being reviewed and are being reviewed now because of the difficulty in meeting what were the previous requirements with, for example, an inability to perhaps do presentations, to go to meetings, attend courses that are compulsory, do clinical exams, etc., that were possible prerequisites, attend conferences. So all those elements are being looked at so that the regulations and the requirements for application in 2021 for 2022 may, we hope, reflect these COVID difficulties. So we're hoping that they will be more flexible.
Right, yeah. And certainly I have been talking to a number of the training boards and they are acutely aware that COVID has disrupted attendances at conferences, courses, even training terms or clinical rotations. And so they are acutely aware of that and they are looking at the type of impact that it has accessing these activities, learning and professional development activities and clinical experience, and they will try to accommodate that in the selection process so that they're not asking something which has not been achievable or is unreasonable to expect a junior doctor to have achieved in this disrupted environment. Okay. Well, thank you for that. Richard, back to you. Now, will selection, now that we know that selection is running for the majority of the training boards, will selection count towards the maximum allowable attempts at selection for those training boards that currently have that as a requirement or as a regulation?
Okay. That's a difficult one to answer because ultimately that's up to the individual training, the specialty training board to decide whether or not that will be counted. In general and in principle, during this COVID period, most of the restrictions and limitations have been lifted. But it would be wrong of me to say to anyone, you're perfectly safe. You really do need to check with the specific training board and to double check what the position will be. But in general, you know, RACS is saying, the college is saying that during this uncertain time, it shouldn't count, but it is up to the individual training board. In much the same way as at selection, the training boards prioritize different things. Things are given different points, there are different time frames. So unfortunately, I can't answer that question directly.
Yeah, okay. And I think probably plastics is one which is also looking at this question quite closely, because it does have it in their requirements, and I think that anyone who is eligible to apply and who applies for selection should confirm that with the respective training boards, just to find out, does this actually count towards my my maximum allowable selection attempts? Jenny, did you put your hand up, or you just?
Yeah.
No, Kerin.
Yes, Kerin.
So, orthopedics does have that clause that it's three tries for selection, and I certainly can tell you that they're considering not including that this year because of COVID. So it's definitely being considered.
Right. Okay. Thank you. Kerin, over to you again. So we now know that selection is proceeding this year. Will there be the usual number of vacant training positions for successful applicants to be appointed to?
Well, because we've had a delay in the fellowship exam, there actually probably won't be the same number of positions available for next year as in a normal year, which I know will concern a lot of you because people won't be sitting till later in the year. They may not have finished all their requirements for training, etc. So that's going to give us a little backlog to next year. But the good news is that those people will get through next year, and so we should have a few more jobs next year available. And then we should catch up.
Yeah, I think this is probably one of the hardest aspects of the selection and allocation process to predict, because there are many factors that that determine available positions, because every training board has a number of trainees at any one time who are on interruption of leave, whether it would be parental leave or research leave, etc. And a number of those will be coming back into the training system. And of course, we aren't running as many, well, we are running a fellowship exam towards the end of this year, but where we normally run two, we're only running one this year. So we aren't going to have the same throughput. But nonetheless, I think the majority of training boards have anticipated that there will be vacancies, but it would be important for applicants to understand that those vacancies may be less this year than in previous years, for obvious reasons. Did anyone else want to add to that response? Linda.
Hi, sorry, I just had a question mainly directed towards Richard and Kerin. In regards to the maximum attempts for the trainees, is there an expected time frame that the trainees can receive confirmation of this? I understand that it's going to be limited to the surgical subspecialty boards, but from maybe a BSET space, is there something that they can expect? Because it is a point of anxiety, and I know from trainees that this is something that weighs quite heavily on their mind.
So
Well,
it's Kerin.
Yep.
Sorry,
Yep.
I was just going to say there was a BSET meeting in June. So I think this is the topic that we should bring up at BSET in June, Adrian, with the specialty boards.
Yes, my understanding is that people would be notified before they actually progressed in their selection process. So they can put in the applications, but they will be told pretty soon before the applications close. That's my understanding.
So
Yes,
before the 12th of June, sorry. So before the 12th of June.
Well, I think most of the training boards have made their decision about that, and so they will be publicising that as soon as they make the decision before the 12th of June. Yeah.
Great. I had one more question.
So good question.
Sorry.
Yep.
My question was regarding the selection process. I understand that it's an ever-changing environment, but has there been some consideration for a contingency if, for example, in August and October, there are restrictions? I mean, I'm hopeful that the restrictions will be lifted, but there is a chance that restrictions may come back into play. Has there been some consideration of this?
I think if the restrictions come back, and depending on what level of restriction, then that may well scuttle all these well-intended, best-laid plans. So we can only deliver to what is actually allowed. And once we try to plan to deliver selection in as COVID safe way as possible, it's not COVID proof, as in, if there are strict quarantine laws and travel requirements, then we will have to comply. And because we have not established remote selection as a standard, this is all very new to our college, then it's very hard to undertake that without significant risks. So yes, it is possible that if restrictions are reimposed, then we may not be able to run selection. But that pretty much goes for most of college-related activities. We're trying to make sure that we plan in a sensible, safe way and have reasonable contingencies so that we can implement them. But of course, and I think most people would understand that there are limits to what we can achieve if there are significant trends with the COVID transmission rates taking off again.
Sure.
Yes, Julian.
Thanks, Adrian. Linda, I can share some of the planning work that's being done, and that is that there's been quite a lot of discussion, and it's been fantastic. The college and specialty societies working together to look at potential contingency plans around selection. So that's, for example, included the possibility of online MMIs. Now, no decision's been made, and I think, as Adrian said, the challenge is that whatever route you go, that there's always some risks involved, and I guess that you take on different challenges if you go down the technology route. We're going well tonight, I think, but there's always that risk that you have your selection interview online and there are complications. So everyone is working hard to minimise the risks involved and to really work through what the best route is. And I'd want to reiterate on behalf of the college that the focus is about the registrar trainee experience in all of this, because we all of us on this panel have been through high stake exams and selection processes. They're stressful enough without not knowing quite where you are. So that's very much in the forefront of our minds.
Yeah. A couple of questions have come through the webinar, which relate to a question that we had attempted or had answered before, but seems to be still needing some clarification. And the question is about junior doctors doing training terms in surgery or whatever, and then having those terms disrupted because of the COVID requirements, whether they be redeployed or the type of work that would normally go through that unit has been minimised. And so how does that actually affect selection criteria or eligibility? And I think I'll go back to what has been said already, that is, training boards are very acutely aware that this is happening, can happen and has happened, and so they will try to work out what is a reasonable eligibility requirement, taking into account that people's clinical experience in many cases have been disrupted.
Yeah.
Okay, look, I'd like to move on to still stay on set selection, but moving on to next year and beyond. And this is a question for you, Jenny. Given the unavailability of courses and conferences, will attendance at courses and conferences and presentations at these conferences still be a requirement for set selection in 2021 and into the future?
Thanks, Adrian. I think we touched on it earlier with the other questions, but I think it's certainly the importance of presentations and attending conferences will still be part of the requirements. but we know that the boards are looking at their requirements for next year, understanding that there are going to be those potential candidates who've not been able to do the compulsory courses and also have not had the opportunity to present in the normal way. However, there are still conferences that are being run online and virtually, and I'm doing one vascular one at the moment for London. So I think it is important that you all look and see what you can still attend, and that will count. So we are certainly encouraging the boards to be accepting of all those opportunities.
Okay, and I think we would encourage all junior doctors to look out for those opportunities and also to seek advice from the training boards, because training boards will be putting out information about how they can optimise their eligibility or chances of being selected next year. So, Kerin,
can I?
Oh yes. Jen?
Sorry, I just want to again encourage all our potential surgeons to not just look at 2 or 3 parts of the CV, but to look at other elements that we're looking for. You know, the leadership and other qualities, teaching, and make sure that they really do research and look at what the requirements are, because they will change, and just make sure that they're not that they're being broad and diverse in getting their experience. Yeah.
Yes, very important point, and we might come back to that in a minute as well, because I think that is quite a point that needs to be expanded on. So, Kerin, we've asked the question about, are training boards going to make allowances in their eligibility requirements? So this is a similar question, but I guess it's turning it slightly different, and it is a question about given the disruption to clinical terms and research activities as a result of the pandemic, how will I, if I was a junior doctor, be able to meet eligibility requirements to apply for SET? So what can I do to meet these requirements?
So as Jenny said, and as the others have said, I mean, obviously you want to look at all the requirements and make sure that you've done everything that you can do in the current environment. But if you have been disadvantaged, if you haven't been able to progress on a term, if you haven't had the availability of a term that's required, like emergency medicine, or you've been prevented from moving hospitals, as a lot of trainees have been kept in the job for the second term, then the college and the training boards have said that, trainees will not be disadvantaged because of the pandemic. So it's very important that you speak to the particular subspecialty training board, you speak to the college, you get advice, you talk to your mentors, and find out, is there anything else you can do, anything else you need to do, but you will not be disadvantaged because of the pandemic.
Yeah. So let's say many training boards actually have time limits. Say you must have done a critical care term in the last 3 years. And then, but what happens if they did a critical care term 3 years ago, but they haven't been able to apply this year? They've been precluded because they didn't register early this year. And then they apply next year, by which time the critical care term that was previously counted is now not counted because it falls outside of the recency in the 3 years. How will the training board, how do you imagine the training board will deal with that situation?
First of all, I'll say you're very good at asking difficult questions, Adrian. But
these are not my questions.
No, I know.
These are the questions of the junior doctors. Yeah.
No, that is definitely something that you need to go directly to the training board and ask advice. What do I need to do? I'm very worried about this situation. Get on the phone, speak to somebody that's involved in that specialty or at the college. And like I said, the college has taken a stand that you will not be disadvantaged. And I'm very confident that your situation will be looked at individually.
Yep. Okay. So many who are attending may not know, but as a college, we developed a set of principles to guide our decision making as we manage this particular unusual time. And I realized that when I was reading a lot of your questions, you were asking questions that perhaps we had not fully thought about. You know, we thought about many of these issues, but not all of them. And I think that this particular question that I just asked about the time limit was not something I had previously thought about. But the principle that we're going to apply is that we want to minimize any disruption and disadvantage that an applicant might have because of the COVID. And so we would say to the training boards, in fact, the training boards have adopted these principles, and they would agree that they would have to look at coming up with criteria that would not disadvantage that particular applicant, i.e. they might say, okay, we will have to extend that requirement for 4 years, not limited to 3 years.
Correct.
And what about being redeployed? If someone's been redeployed from a surgical term and they end up doing a non-surgical term because of the COVID, do you think the training boards would also accommodate for that?
Absolutely, and that's one of the major principles that we've adopted, that the trainees will not be disadvantaged. So again, individual basis, have to make, discuss it with someone, write a letter, send an email, have a talk to somebody, but you will not be disadvantaged.
Right, okay. So Linda.
Yeah.
So just to clarify, the general feeling is to encourage trainees in the pre-vocational space to communicate directly with their surgical specialty boards to consider their personal situation.
Correct.
Okay, yeah.
For example, can I just give an example? Say you're applying next year, you're putting in your application in January, you've been disadvantaged because you couldn't do, for example, an intensive care term this year, and that's the only thing left, you've done everything else, then, the specialty training board could have a look at your terms for next year and consider whether you can make that up. So that's a possibility. I mean, obviously it's going to be tricky and people will have very, very different range of problems, but we have stuck to the principle that you will not be disadvantaged.
Okay, thank you, Kerin. Linda, now that you've put your hand up, I was going to ask you a question. Even if a junior doctor meets their minimum eligibility requirements, how are they going to optimise the chance of being selected, given that there have been disruptions caused by the pandemic? So how can a junior doctor best prepare for selection?
Yeah, sure. I mean, I think selection is a very stressful process, even without the coronavirus pandemic. And then I think we need to consider that the applications for 2020 as well as 2021, they're going to be quite different. With all of the considerations and the discussions that we've had regarding the maximum attempts and things like that, I think trainees need to keep that in the back of their mind, so they really need to understand and be in contact with their specialty boards to determine whether they're going to be applying for 2020, 2021 or both. And I think an important thing to stress is that selection is not just about technical skills. During this pandemic, I think it's been a really non-technical skills have had a chance to develop. So things like repurposing our clinical teams, management and leadership that we've touched on, I think that's really important. And I think maintaining a close discussion with your mentors and network supervisors, and then attending these webinars, I think it's good to keep your finger on the pulse at all times. And then of course I encourage you to be as agile as you can. Interview practice and CVs are always going to be more difficult during this time, and I think it's important to take advantage of the things during this pandemic as well, including conferences. So there are lots of virtual conferences that people are able to attend, meeting requirements that way. And then of course, understanding all of the ins and outs, keeping in touch with the updates from your surgical specialty boards is very important.
Right. Thank you for that. I mean, I think you're very close to the ground, so you're well aware of what is achievable and what the junior doctors are going through. Did you have a question, Richard, or wanted to add to that? I thought I saw your hand go up.
No, that wasn't. That was something else.
No, that's okay. So ask a question to the whole panel. I guess anyone can answer this. So would you recommend that junior doctors document what they're doing, and how would they document that they've been developing leadership and management skills? How would they document that they've been looking after health advocacy? You know, these are all necessary competencies of a surgeon, but how do you go about documenting those learning experiences?
Adrian, I think JDocs may give you some of. I think JDocs may give some ability to keep records of that sort of thing and build your portfolio.
Do you want to, for those who don't know JDocs, I think many junior doctors know about it, but for those who don't, would you like to explain what JDocs is?
Well, JDocs is a platform that's available through the college for junior doctors who aspire to be surgeons, and at the moment it's more geared to the PGY 2 and 3, but we very much are working on expanding that, and it does enable you to build up a portfolio. It has lists of activities that it walks you through, which are ones that you can be ticked off and you know, gain just through this, you know, gain experience in. So it's it also has trial exam questions. It prepares you for your GSSE, etc. There's a lot of resources. It gives you access to the library. So it also helps us know who you are. So it gives us you can, it's like a registry, really. So when we were talking about who to invite to this webinar, for example, we were thinking, well, we have those that have already registered for applications for surgery, but we've also got the JDocs registrants too. So that, I'm just saying, that is one way, anyway, that you can build a portfolio.
Thank you. And Julian's typed up the link there. Kerin, do you have anything else to add to that?
Yeah, just for some examples. So we've been encouraging our trainees to do some of the non-technical competencies, teaching, scholarship, things like that with our trainees, running webinars, running Zoom sessions, doing teaching with our students. And then we've been giving them letters from our university and from our hospital to show that they've done these things. And we've had more teaching happening since the pandemic started than we've ever had, which has been amazing. And a lot of it's been run by our prevocational doctors. So you can get a letter from, you know, your university professor, from your JMO manager to put in your CV to show that you're doing a whole lot of stuff in the non-technical space that you may not have done before. And these things will all pad out your CV and just show that you are working on all those non-technical skills.
Yeah, and I have to say, from a personal experience, the medical students in my world have been very flushed with a lot of registrars doing a lot of Zoom tutorials, etc. Yeah.
Correct. Correct.
And just on the JDocs website, Jenny, is any junior doctor able to access that, and particularly all the resources that you mentioned?
Yes, there is a fee attached to it, but yes, it's not a huge fee. We're working on expanding it so that it is more. I know you have some resources through the library, but we're looking at possibly making other parts of the college website available as well at this. But yeah, it's a little bit limited at the moment.
Yeah, but there are parts of the JDocs. Yeah, there are parts that junior doctors can access without paying a fee. Is that correct?
Yeah.
Yeah.
Oh, Julian. Well, I think without JDocs, they would only be able to access what the public can access on our website without being a member. Yeah.
Yeah. Okay.
Yeah, that's correct,
Yes,
Adrian. I mean, I think the two great assets in JDocs is one, the framework that helps you to go on that journey as an aspirant surgeon, so that you understand fully what's required of you to be able to reach selection. It doesn't, obviously, it's not a precursor for that, but it's a helpful framework for people. And the other bit that Jenny mentioned, which is the fact that we then know who you are, and it's the beginning of that kind of relationship with the college, and that's, I think, mutually very beneficial, and that we're able to get communications to you, share things with you, and you're also able to communicate with us and begin on that surgical career.
Yeah. We've got one more theme to get through about courses, but I just wanted to ask one question that relates to something around selection, and maybe it's more about selection in 2020 for 2021, and it relates to the time frame. So selection this year, instead of being held, or the process starting now and being conducted and completed by September, it's more likely it's going to be completed closer to October or even into November. So the question is about how are we as a college going to facilitate the employment of junior doctors who may not know about whether they've been successful in set selection until late in the year, and what does that mean for them applying for a non-accredited position, because no one wants to be without a job next year, and what are we doing with jurisdictions to work with them about ensuring that employment contracts are facilitated late in the year. And I guess this applies for both Australia and New Zealand, because New Zealand changeover time is traditionally in December. So who would like to answer that question? Thanks, Richard.
So I've just been on a teleconference before this. So for those New Zealand pre-vocational doctors, unless you have a very specific contract, you are actually employed for life. So as long as you stay within your jurisdiction, they have to give you a job next year. All of the junior doctors, virtually all apart from one group in central New Zealand, have had their rotations delayed. And this is part of a nationwide process to try and get New Zealand changeover period to match Australia. So all of you who are concerned about your second half rotations not fulfilling any of the time requirements because it's been shortened by a month, all of the jurisdictions are moving at the moment and working closely with the unions to extend the year for everyone, so that we will be in better alignment with Australia. But ultimately, the way that the jobs work is that when you're employed, unless you have a very specific contract that says you're on a fixed term contract, every junior registrar who's employed in New Zealand has a job for life in that DHB, within that jurisdiction. And in fact, I've got a junior doctor now who's actually older than I am. But that's the advantage of working and living in New Zealand. Apart from the fact we only have 8 COVID patients, that's the other advantage of working in New Zealand.
But Richard, if you have a New Zealand junior doctor who applies for a surgical training program this year, is successful, but they're notified in October, let's say late October, is that enough time for them to give up one job, which is a non-accredited job, and be employed into an accredited position?
So New Zealand is different, as I'm sure everyone keeps reminding me. And what happens is all the jurisdictions have, so our trainees also have a job for life. So there are jobs set aside just for the set trainees. And in fact, wherever you are posted, there will be a job for you, okay? And everyone in New Zealand knows at the moment that everything's been delayed. All of the jurisdictions know, and we're all factoring that in to our interviews for house surgeons becoming registrars, and for the junior doctors as they move around, and also for the set trainees.
Thank you, Richard. Maybe after the travel restrictions are lifted, there'll be a whole lot of Australian junior doctors going across for these lifelong jobs.
Yeah, and they pay for all of their expenses and training as well.
Right. Okay.
That's right.
And so Julian, what is the college doing in terms of liaising with the Australian states and territory jurisdictions about working with them to facilitate employment towards the end of the year, the employment transition?
So, yes, because obviously we're very conscious around two key issues. One is that selection now is up and running, but it is delayed. So we have been communicating with jurisdictions across Australia and New Zealand to alert them to that, post-allocation is unlikely to happen till the end of October, probably November in most cases. We've had positive responses to that. I've personally spoken to New South Wales Health. So I think that will, I'm expecting that to land well across the board. We've also written to jurisdictions around some of the concerns raised around the possibility of mandatory extension to rotations and to posts, and so we're also very aware of that and the implications that might have. So we're also communicating with jurisdictions, particularly in Australia, where that's been a risk. But I think again, as the COVID environment's changed, I think the risk of people being asked to stay in their roles and not being able to move on have been limited.
Yeah. Okay, we're fast running out of time, and I did say we had one more theme to get through, which is about the face-to-face courses. So Jenny Chambers, when will the college face-to-face courses, which your committee oversees, when will they be resuming?
The college is aiming to get some of the courses running again in September. That's the plan. My committee oversees the skills courses. There's also professional development courses. So the mandatory courses are the ones that they'll be looking at getting up and running first. But it will be dependent really on what restrictions are still around. We have to match faculty who travel. So it's a lot of faculty travel to help facilitate on courses. So we have to be able to do that to run courses. I think we'd always be wanting to run a course in New Zealand as well as a course in Australia.
Yeah, but I guess the faculty issue is also relevant if we're trying to run courses in regional centres where we don't normally run them. And if the faculty aren't residing in those regional centres, then we would need to make sure that travel restrictions permitted that. Yeah. And I guess on a related issue, and it's probably the last question that we'll have time for, and I'll throw to you, Julian. Is the college looking at online courses to replace many of these face-to-face courses?
Yeah, we are, Adrian, at least where that's suitable. So you'll know that the model we have relied on historically is flying everyone from anywhere to come together to run courses. There are, of course, some great advantages to that. The networking, the fact that, of course, surgery is a craft skill, and so a lot of these things is very hands-on. So it's not to bravely storm forward into the online world blindly, but there's certainly, we are working hard to re-look at the educational offer. So where face-to-face is still appropriate, that will happen, and as you mentioned, that still needs to happen a little bit more in a more sophisticated way. So we are mapping out where are our faculty currently, where's the need for training, in order that if there's limited travel, we can try to deliver courses spread across the two countries as best we can. And then, of course, there's the idea around building more what I would call asynchronous learning, so e-learning type facilities, and building more online in your own time type learning. but also developing synchronous learning. So the college is looking to invest in new AV infrastructure across the network at all the different offices across Australia and New Zealand. And that therefore gives the opportunity for multiple hubs to deliver new synchronous learning, where you as a member of faculty can go to your local RACS office, and you'll be in a position to deliver online live teaching to people who either could come to RACS offices if they're able, but actually it's a huge opportunity for those rural remote settings to be able to access that learning too. So I think we are thinking differently about how we deliver teaching. I think it's of course at the moment driven by COVID, but I suspect the audience we're talking to as well are interested in the carbon footprint. And so I think it's a huge opportunity to look differently at how we do things by taking learning to where people are, rather than the traditional model of flying everybody to where the learning happens to be.
So, well, thank you very much, Julian. And on that forward-looking comment, we have run out of time, so I would like to thank each of you on the panel. I'd also like to thank Grace and Shannon in the background, keeping things moving, and also to all of you who are attending this webinar. I thank you for your interest. There were a few other questions that came through, and I know, Richard, you flagged that there were a lot of questions on GSSE and registration. So what we will do is we will make that information available. It will go up on the college website. Look under the COVID hub, and please keep yourselves informed. Thank you once again. We will look at running follow-up webinars over time. But until then, stay safe, stay well, and have a good evening. Thank you.
Bye.
Bye. Bye. All the best. All the best.